there are some of those numbers in terms of Brandon. So my understanding is that 24 folks went to Brandon Regional Health Center, and that includes patients who require mental health, surgical support, medicine care, obstetrics, some ER patients, and ICU patients. And to Trina's comments, a lot of work has been done to build up capacity in Brandon. So the timing actually, in terms of having more capacity at that site, it aligns well to support these folks. But I also want to take a moment to thank all of the healthcare workers who, when we talk about these emergencies, there are a lot of healthcare workers who really step up to this challenge and are very willing to move to other sites. That's where leadership from Trina and other folks is really, really important to make sure that it's a smooth transition for healthcare workers to work at other locations. We also have to keep in mind that healthcare workers themselves are affected by these emergencies. And so making sure that we're working with all of our partners, including the unions, to support these healthcare workers in having their needs met as workers, but also making sure that they can attend to their own lives and circumstances is foundationally important to the response.
And just quickly, in terms of someone who has an emergency surgery, something that needs immediate attention, can they get that level of care in the region in this temporary clinic? Kind of what level of capacity is there for kind of serious surgery or anything given this is now shut down?
I can start and then I'll ask others to add. But no, we have very limited services right now in Dauphin. We, because of the power outage, we are lacking access to diagnostic services. So really we have physicians and nurses who can do a primary assessment, and we would rely on our ERS partners to transfer patients to the nearest and most appropriate emergency department based on the patient's care needs, and proceed accordingly. Surgical services will continue to be offered in Brandon as they are currently, and so anybody requiring any emergent surgical service would be transferred to Brandon as a priority. We strongly encourage people to call 911 as they normally should in the event of any emergent situation or if they're not sure about their medical circumstance.
Okay, thank you. And then the Premier was talking about kind of looking ahead and kind of building resilience. Is it standard to have the backup generators in the basement and vulnerable to flooding like this? Is this something that I'm not familiar, but it sounds like it is a vulnerability. Is there kind of thoughts of doing it differently in the future to prevent this kind of thing from happening?
Sure. Maybe I'll speak to that and then turn it over to Trina. Anytime there's an emergency, there's always that after everyone is safe and we've been able to ensure that it's been addressed in full. There's always a review, right? There's always that look back to see if what needs to be done differently moving forward. What protocols and policies can be improved. So should there be another emergency, that we can address that in a better way than maybe previously we learned. We always are looking for opportunities to learn and improve. Again, the team was working also proactively, knowing that there were big flooding risks ahead. Folks were planning and preparing, and you can have all your best laid plans in front of you, and yet the environment throws something at you that you have to adapt to. So the team has been adapting. They've been very nimble in this emergency, and I have to commend them for that. And of course, we will be reviewing and evaluating and seeing how we can better prepare for an emergency like this in future. But I turn it over to Trina to maybe talk a bit more about the circumstances.
Thanks, Minister. I think you answered that very well. But just the main power source or connection point in the hospital is located in the basement. I can't really speak to how unusual that is. However, to the Minister's point, we always take opportunities to learn from any event that occurs so that we can, reduce risk and mitigate, similar situations in the future.
Joseph from CBC again, sorry. I just wonder, is it the first time the center of Dauphin is going through such a situation?
Yes.
As far as the organizational memory goes, no one can remember a flooding episode like this to our health center in Dauphin. And, I think you've heard the mayor of Dauphin speak to the fact that nobody in Dauphin recalls a flooding event like this to the city in general. So it is certainly an unusual circumstance.
Okay, thank you.
I just have a question here. How many surgeries and procedures has the Dauphin Regional Health Centre had to cancel so far this week for patients due to the flooding?
I don't think we have that information handy, Tessa, but there's been proactive communication with anybody who has had canceled, who we've had to cancel or reschedule appointments for, and have been offering appointments at other facilities in a timely way.
Tessa, just one more question with regards to the timeline. Obviously, the main issue here is the power, and you said the power source is in the basement now. Just speaking about the discussions with the insurers and the restoration companies, is there a way to prioritize getting that power back on to at least be able to bring back some of those services as quickly as possible, and then dealing with, I'm not a restoration mechanic or anything like that, but dealing with that side of things after the fact? Have those discussions been had about prioritizing at least getting this power back so that you can start to bring back some of the services online?
Yeah, I think we've already, as we mentioned, I think we're already talking about and planning for the reopening plan. And so absolutely power to the building would be the absolute priority. We need to, first thing is to eliminate the water from the basement to be able to assess where we're at and be able to reestablish power as a priority for sure. The HVAC system will be the next concern after that, especially in view of the warm summer months ahead of us. And ensuring that we have climate control to provide safe patient care. So absolutely, those will be the priorities as we move forward. It's challenging to know, how long, but absolutely we'll be moving as quickly as we can to ensure that we are reestablishing services, and in the meantime working to ensure that services can be provided to patients and people of the public in a coordinated way.
Thank you. I have a last request, Joseph from CBC Radio. Is there anyone who can just give a brief summary in French right now?
Sorry, Joseph, I don't believe we have anyone who speaks French.
Oh, okay, it's fine. Thank you.